Pose with the bands. Pose with the pose with the pose with the bands. Pose with the pose with the pose with the bands. Pose with the bands.
First of all, we're gonna start with a scenario for lower back pain. Name given, Mr. Ahmad, age 38 years old, occupation as a warehouse worker and working experience for 10 years. Mr. Ahmad's background. Mr. Ahmad works as a warehouse worker where his job requires lifting heavy boxes, bending and standing for long hours. Recently, he started experiencing lower back pain, especially on the right side after long working shifts. What is back pain? Back pain is a symptom of a strain, sprain, spine disorder or condition affecting organs in your pelvis or belly. Pain can range from mild to severe and it may spread to your legs or elsewhere. A healthcare provider can identify the cause of your back pain and recommend treatment to your help and find relief. Next, the causes of back pain. First, mechanical or structural problems. For example, like scoliosis, strain and injury to a muscle or tendon, and sprain, an injury to the ligaments that support the spine which connect the different bones together, often occurring from twisting or lifting improperly. Second, inflammatory conditions. For example, ankylosing spondylitis, which is a specific type of arthritis of the spine. Second, other types of inflammatory arthritis of the spine. Lastly, the other medical conditions such as osteoporosis, which can lead to painful fracture of the vertebrae. Second, kidney stones or infection. And lastly, pregnancy. We're moving forward for the symptoms of back pain. Back pain can range from local pain in a specific spot to generalized pain spreading all over the back. Sometimes the pain radiates away from the back to other areas of your body, such as the buttocks, legs, or abdomen. Depending on the type, causes, and location of your back pain, you may experience such as increasing pain with lifting and bending, worsening pain when resting, sitting, or standing, back pain that comes and goes, pain that radiates away from the back into the buttocks, leg, or hip, and lastly, numbness.
Moving on the next stage of occupational therapy process, we have the evaluation phase, which is we will be discussing the occupational profile. The occupational profile is the very first step of our evaluation. In this stage, the therapy focuses on gathering comprehensive information to understand the client holistically. We don't just look at the injury, we look at their life, their role, and what matters most to them. To illustrate how the occupational profile works, let me introduce you to Mr. Ahmad. Mr. Ahmad is a dedicated warehouse worker, but he was been struggling with chronic low back pain recently. When we look at Mr. Ahmad's background, we can see why it is so impactful to him. He works long shift around 8 to 9 hours per day, and his job isn't easy. It requires constant heavy lifting, bending, and standing for a long period. Because of this, now he finds it extremely difficult to maintain his work performance during physical demanding tasks. Now we're going to move to analysis of occupational performance. In this stage, the OT analysis. How will the client perform occupation? This includes synthesis information from occupational profile, conduct activity, or occupation analysis to identify task demand, selecting and using assessment to evaluate, which is quality to occupational performance, performance skill, and performance deficit, and last but not least, assessing client factor. Now we're going to talk about synthesis information by occupational profile. Based on occupational profile, the client experiences difficult performing work-related lifting tasks due to lower back pain. This condition impact daily routine, work roles, and overall occupational participation. Although the client value independence and work performance, pain and physical demand limit functional ability, indicating the need for occupational therapy intervention. By task demand analysis, which is lifting heavy box. From lifting heavy box, Mr. Ahmad needs physical strength demand, which is good range of motion of hip, knee, shoulder, and spine is necessary to perform bending and lifting movement. After that, Mr. Ahmad needs a cognitive demand, which is Mr. Ahmad must be able to judge the weight of the box and plan the movement sequence appropriately. After that, sensory demand. From a sensory demand, Mr. Ahmad needs visual input to help him locating the box and navigating the environment while carrying it. Last but not least, environment factor. From environment factor, such as floor surface, available space, lighting, and the height of the surface where the box is placed can influence task performance. Now we're going to move to assessing client factor by testing strength for back pain. Therapists will examine client's spine and posture to look for changes in the body structure. After that, therapy will asking client to bend or lift client leg to determine how movement affect client pain. This is for to testing client reflex muscle strength and sensation. Now we're going to move to range of motion test, which is we can use Cobra test to determine if there is a decrease in lumbar spine range of motion flexion. After that, we can use fingertip to floor test. That a flexible assessment used to evaluate spinal flexibility, hamstring flexibility, hip and lower back mobility.
To conduct the test, have the patient in barefoot, standing upright with the feet 30 centimeters apart.
Then mark 1.5 centimeters below the line of the two iliac crests and another one 10 centimeters above.
Measure the distance between the 2 points, which should be 15 centimeters. Then the patient flexes as far as possible, keeping the legs fully extended, and the distance is measured again. The difference between the 2 measurements indicates the amount of flexion.
Within the BUSME, lumbar flexion limitation is categorized as mild if the difference lies above 4 centimeters, as moderate if the difference lies between 2 to 4 centimeters, and as severe if the difference is less than 2 centimeters.
Measuring thoracolumbar flexion using the fingertip to floor method. I have the patient standing. I'm going to have him bend forward and I'm going to measure the distance between his middle finger and the floor. Go ahead, bend forward and touch the tips of your toes if able. And he measures at 17.5 centimeters, so I would mark that down. Tip to floor method.
Pain. For example, lumbar test. A lumbar puncture, which spinal tap, is a procedure where a healthcare provider inserts a needle into your lower back to remove a sample of cerebrospinal fluid. Cerebrospinal fluid is the clear fluid that surrounds your spine and brain. This test can help diagnose conditions that affect your brain, nerve, and also spinal cord. For the assessment tools, we use 2 types of it. For the first one is numeric rating scale, NRS. For the second is manual muscle testing, MMT. For the numeric rating scale, it assesses pain intensity. The client reports lower back pain at 7/10 when lifting test. For the MMT, muscle strength will grade it from 0 to 5. Core muscle strength assessed as grade 3/5, able to move against gravity but not against resistance. Next, synthesis of the evaluation process. For this stage, it involves summarizing and interpreting all evaluation findings. Occupational therapists will interpret assessment data to identify supports and barriers, identifies occupational performance problems, determines desired intervention outcomes, and also they will provide clear direction for goal setting. Lastly, conclusion for evaluation. Evaluation in occupational therapy involves developing an occupational profile, analyzing occupational performance, and synthesizing evaluation findings to identify client priorities, strengths, limitations, and goals.
For intervention on this case, we use assessment tools such as for pain, range of motion, and muscle strength, which is NRS, shoulder test, and also manual muscle testing MMT. So by NRS, we identified that the problem is moderate to severe low back pain during lifting. OT intervention is to pain management education, activity pacing, and proper posture and lifting technique. For range of motion, we use shoulder test. Problem identified is limited trunk flexion and rotation. And OT intervention is trunk stretching exercise and warm up before shift. For muscle strength, we use manual muscle testing, which is MMT. Weak core and low limb muscle is identified. Core strengthening, lower limb strengthening, functional strengthening is OT intervention. For intervention plan, our focus is to reduce pain. First, pain management education. Teach proper body mechanics, bending, lifting, sitting, and standing. Number 2, back care principle during ADLs, which is dressing, sweeping, and cooking. Number 2, activity modification. Break heavy tasks into smaller steps. Encourage rest breaks during prolonged activity, standing, studying, and working. For increasing muscle strength, we use graded straightening exercise, core stabilization exercise, back extensor straightening. Start low, so we gradually increase the intensity of the exercise. Number 2 is task-oriented straightening, functional lifting, using light object, carrying groceries with correct posture, and sit-to-stand practice. To increase the range of motion, we use ROM exercise, Active ROM for trunk flexion, extension and also rotation, and gentle stretching for back and hip muscle. Number 2, postural training. We use correct sitting and standing posture, use of lumbar support when necessary.
Let's proceed to the outcome. Outcome merge from the occupational therapy process and describe the result client can achieve through the occupational therapy intervention. The focus on outcome is woven throughout the process of the occupational therapy. Assessment tools, NRS, client report lower back pain at 7% when lifting tasks. After the treatment, client report lower back pain at 3% when lifting tasks. MMT before treatment, core muscle strength assesses as grade 3/5, able to move against gravity but not against resistance. After the treatment, core muscle strength assesses as grade 4/5, able to move against gravity and has moderate resistance. In the conclusion, client are able to lifting a heavy object, for example heavy boxes. Client has less pain at the lower back pain, such as increase the flexibility and muscle strength. Client need to proceed to the work hardening for factory worker with the back pain. For example, weight and repetition are gradually increased.